Lean is not a tool. Lean is a way of thinking. It changes your thinking on how you actually look at the service or product that you're providing. It focuses on value and non-value from the perspective of your client, in this case the patient, or your customer. People are, a little reluctant to say customer, but that's what a patient is. Look at it from the value and non-value, examine the non-value, and remove the non-value properly. Don't attack it, don't create exciting chaos, but change the thinking in there to understand here is where we're going as an end-to-end process, and this is what we have to do to get there. The culture changes, people get excited about it, and the people, I have to say, in healthcare, what's exciting is you don't have to give them passion. They have the passion to take care of patients. What we haven't given them is a process that can effectively do that. They're working in broken processes and somehow providing care to you and I. They're heroes. So what you have is patients entering the healthcare system, and their clock starts then. Wait time for them starts at that moment when they need treatment or assistance from medical people. What happens in the system, though, it's not designed to flow. It's designed to hand you off. So you end up going from node to node to node. And in between those nodes is where you have the wait. And what we have now in Canada, one of the primary, concerns is our focus is on wait times. It's not just wait times that we need to focus on. We need to focus on the whole end-to-end process and realize that fixing a node in that process will actually create what we call exciting chaos, because you can improve your wait times in emergency, but if you have nowhere for the patient to go if they're being admitted, what have you done? So we find hospitals that are actually getting them through emergency faster, but nowhere to go. They're jamming up the wards, they're sitting on or laying on gurneys. And that is not flow, and it's actually very frustrating to patients, and we're kidding ourselves by saying, okay, we've improved the patient experience. Actually, we've made it worse. I think I'm going to point the finger at, there's a lot of reasons for it, but let me go to one that I can talk about and be blunt about. I think consultants have done that. I think their lack of knowledge of how to actually go in and transform the system has created that problem. Because they like to go in and improve a point. They can do it quickly, it's visible, they can go to the CEO of the hospital or the facility and say, look what we've done. We've doubled what you could do in there. We've doubled your capacity. CEO looks at it and gets excited about it. In fairness to them, they don't understand that it's an entire system. And they're going, hey, I look good. Compared to all the other organizations around, we're doing great. And this consultant did a great job. So the consultant is the fireman and the arsonist, right? He put out the fire, created chaos on the upstream and downstream. So now he says to the CEO, hey, you have other areas we can work on. So we start bouncing around, and that's why it's called exciting chaos. We got lots of projects going on. I mean, everybody in Canada and the US where we work, everybody's tackling all these projects. You know, I was at a hospital, they had 75 projects. They're all working at 100% right now. How can they handle 75 projects? And every one of those projects is just a point improvement. And every one of those point improvements is going to create more chaos. And so we get into that cycle where we think we're doing something great and we're trying. And in fairness to all the healthcare people, they really are. But that's why I point the finger at the expertise, loosely said, that's coming in to say, this is what you need to do. You have to change the culture. You have to change the thinking if we're going to improve healthcare. We go in and we draw out the entire system, all the activities, the information flow, patient flows, even the medical flow that is being administered to the patient. We look at it end to end and say, look, here's all the non-value in there, and wait time's a big one, right? So here's all the non-value, your quality issues, all of those. Now, how do we go about changing what we call a value stream, the end-to-end process? How do you go about transforming the whole thing so that you take it from here to here? Not just go in and start plucking easy wins, you know, the matrix, high effort, low effort, high impact, low impact, and doing it in a quadrant, but actually look at it and put a vision together of what the future state really looks like, because that's what the CEO needs to have. He needs to have that vision so that he can communicate that vision to all their staff, and therefore, when he does that, everybody comes on board saying, this is where we're going, we understand. And it's not you or I that are causing the problem in the system. It's a value stream. We're all involved. The focus is on the patient. So we show them how to properly and effectively maximize a sustainable improvement so that you don't just improve a point and then 6 months later it's deteriorated. Because if you don't change the culture, people are not going to accept it.